I'm Brenda Bonamblust, and I have been here on a full-time capacity or part-time capacity for 16 years. I graduated from Kansas State University with my master's, and I worked in the schools for 3 years. I never did think I would be in a hospital. I thought I'd always work in the schools. I quit the school job to stay home and raise my children for a while, and I was home for quite a few years, and then one of my professors asked if I wanted the contract here. I work with stroke patients. We also have a stroke group here that we've had for about 10 years, where we have stroke survivors and their caregivers that come once a month. We meet. And then I work with Parkinson's patients, work with patients who are dementia patients that are just generally weakened, and that weakens the swallow. I also work with ENTs in the area. They refer patients to me for voice disorders, irritable larynx syndrome, dysphagia, also with that, with the swallowing. I think there is a sense of community. Through the schools, there are excellent programs in the schools and excellent administration at this point right now. I'd say that they care about the kids and trying to help kids make wise choices. So the schools, I feel right now, are strong. I'd say there's a strong faith base in this town if people are interested in that. It is just, it's a nice place to live. And there is the in town where you can live, or people can live in the rural areas not too far away from town if they like that peaceful setting even more. I would encourage you to look into this hospital and this environment in this town, because I do feel like we have a lot to offer as far as a community where people do care and people do remember your names. I had a patient the other day who's and he's 85, 87, and he knows people and remembers them from way back, and there's lots of connections. And people do care about each other, and they do interact with one another, and you do see them downtown. Well, I work pretty close with physicians. That's where I get my referrals. In order for me to see a patient, I have to have a referral from a physician, and I feel like it's a team approach. For the most part, I really feel positive about that. And they want to help their patients have a better quality of life, I feel.